Next up on the broadcast, Congresswoman Terri Sewell from Selma is back on the program with us. Congresswoman, it's nice to see you again.
Nice to see you again.
Welcome back to the show.
It's great to be home in Alabama.
Indeed. Now, you've been making the rounds in Montgomery today. I believe you met with our new governor, Kay Ivey.
I did. I told her that her mere presence is inspiring so many women. I told her girl power, so it was really fun.
Well, it's interesting to note that since she took over the governor's office and then she appointed Lynn Stewart as the Chief Justice, women lead 2 of the 3 branches of state government.
Absolutely. Well, listen, I always say that women make amazing public servants. We do it in our homes, in our communities, and so it's great to see Governor Ivey leading our state.
Congresswoman, I want to begin with health care. I know that you were not happy with the House passage of the health care repeal bill. You see a lot of problems ahead in this legislation, do you not?
You know, the repeal and replace bill, or Trump Care, was a raw deal for Alabama, and it was a bad deal for Americans. I know that the Affordable Care Act is not perfect, but this bill, when you think about coverage, it would kick off 24 million Americans who currently have coverage. When you think about it costing more, and the fact that there's an age tax, older Americans will be charged 5 times more. And perhaps what's most horrifying to me is the fact that this president promised not to touch Medicaid or Medicare, and $500 billion worth of health care cuts, and it's really appalling. And I think that we as Americans should be upset about it. I would rather this president work with Democrats to make the Affordable Care better. Clearly, we have to do something about premiums and deductibles, but that would take bipartisan support. I think that the most egregious part was that we received the bill that morning, and we voted on it at 1 o'clock in the afternoon, and the CBO was not able to score this revised bill, so we don't even know the exact costs. But we do know from the last CBO score that 24 million Americans will lose their coverage, and that includes 200,000 Alabamians. That alone makes me upset.
Do you think there was sort of a rush to get this out of the House?
I do. I think that this president made certain promises on the campaign trail. But you know, what's really disheartening is that my Republican colleagues for the last 7 years have railed against the Affordable Care Act. And what's become apparent is that they weren't ready to govern. They didn't have a bill to put forward. And in 17 days, they put forward a bill. They created a bill in 17 days and really thought that the American public wouldn't be upset about it. I know that we were able to block the vote in April. I know it passed last week, but I also know that it will go over to the Senate. And in all accounts, it may be dead on arrival. My hope is that senators from both sides of the aisle will have an opportunity to work on the Affordable Care Act and make it better instead of starting from scratch.
I know that the president surrounded himself with a lot of House Republican leaders last week and hailing the passage of this, but there were a lot of pundits who were standing back and going, whoa, you know, this battle is only half over, and as you say, it could face a very tough row to hoe in the Senate.
Absolutely. And for me, I think that all of us should look at coverage, whether or not this bill will increase coverage, because that's the goal, the cost, how much will it cost us, and the protections. We want to know that all Americans have full protections. I think that getting rid of the essential benefits and touching pre-existing condition was really a bad deal, and I'm really hoping that in the Senate that they will revive those parts of the Affordable Care Act that so many Americans have come to appreciate.
Pre-existing conditions was one of the things that made the most headlines about this, and what constitutes a pre-existing condition.
I can tell you that so many families called me, so many people from my district called me. I had one constituent whose child has asthma and was really concerned that as a pre-existing condition could possibly be waived by a state. And the fact that they created a risk pool and only funded it partially is unacceptable. Look, I'm all about localized and bringing local control, but I really believe that the state of Alabama block granting Medicaid and having $880 billion worth of cuts in Medicaid is not the answer. I know that so many people in Alabama and vulnerable parts of our society, I don't think people realize that Medicaid, one of their biggest constituency are those who are in nursing homes and children. Children's Hospital in Birmingham couldn't survive without Medicaid. And so we should all be alarmed by this bill. And I just think it's better politics if both sides of the House work on a bill together. I know it's idealistic, but frankly, I think that the people who elected me didn't send me over there to be a part of the problem. I hope they sent me to Washington to be a part of the solution. And I can tell you that all legislation is more lasting if it's done in a bipartisan way.